passionate doctor. I'm called 24/7. Dr. Sugar can answer your questions. She's an inspiration.
Hello, I'm Dr. Sugar, your internet doctor, here to continue our discussion on postpartum depression. I will go into a lot more detail on the specific treatment options available and some lifestyle modifications that you may want to try as well. So if you're ready, let's get started with a dose of medical inspiration. There are two major forms of treatment available to treat postpartum depression. First is medication, and the second is psychotherapy. According to the American Psychological Association, the APA, research suggests that therapy effectively decreases patients' depression and anxiety and related symptoms as well, such as pain, fatigue, and nausea. Research increasingly supports the idea that emotional and physical health are very closely linked and that therapy can improve a person's overall health status. There is also convincing evidence that most people who have at least several sessions of psychotherapy are far better off than untreated individuals with emotional difficulties. One major study showed that 50% of patients noticeably improved after 8 sessions, while 75% of individuals in therapy improved by the end of 6 months. This is really remarkably good results. The APA recommends the following for selecting a therapist: taking recommendations from family and friends if they've had good experience with psychotherapy. You could also contact state psychological associations and ask for referral services. And you can also ask your primary care physician, your family medicine doctor, or other health professional for a referral. This is probably the most common way that it's done. There are also various medications available that elevate mood by balancing the various chemicals and enzymes that are responsible for conveying emotions and feelings, the neurotransmitters. These medicines comprise of different compounds and target various aspects of depression. Your own doctor will be able to recommend the best medication on a case-to-case basis, based on your individual signs and symptoms. And also, make sure to let them know if you're breastfeeding, as they may take this into consideration in prescribing a medication. Another very important thing we should talk about is lifestyle modification. Apart from the above options of treatment, there are also a few alternative medicine options available. While these are non-traditional and lack clear evidence of being effective, many people often feel that they are willing to give these a try. So other things to consider include acupuncture. Now, acupuncture helps promote deep relaxation and sometimes even promotes sleep. This in and of itself may help relieve the fatigue that accompanies postpartum depression. Another thing to consider are omega-3 fatty acids. Now, omega-3 fatty acids are known to support infant brain development during pregnancy. In addition, some research suggests that the omega-3 fatty acids may help relieve postpartum depression as well. Omega-3s are highly unsaturated fatty acids, and these are found in fish as well as in some plants. You can increase your consumption of omega-3s by eating more herring, sardines, salmon, mackerel, and bluefish. Think oily fish when you're looking for fish that are high in omega-3s. You can also get this in the form of a supplement like a fish oil capsule. Another source of omega-3s comes from hemp oil and flax, either in the form of flaxseed, flax meal, or flax oil. Whether you have postpartum depression or not, increasing your consumption of omega-3s is a healthy thing that we should all do. Another thing to consider is massage therapy. Some studies suggest that massage therapy may be helpful for postpartum depression. You may also want to look into creative arts. Art, music, and drama therapy have been suggested as a possible way to relieve postpartum depression, perhaps by providing a supportive, relaxed environment and offering new ways of expression or encouraging positive behavior changes. I also was just reading about dance therapy as another thing to consider. The effort to combat postpartum depression is a constant struggle, and sometimes it may seem like the road to nowhere, but with perseverance usually comes great benefits. It always helps to have a great social network and support system to fall back upon. This is the time for communicating to loved ones about personal emotional ups and downs and what their support really means to you. With regular treatment and help from family, the time will eventually come where anxiety and depression become a thing of the past. All that will be left is joyful moments of caring for and interacting with that newest little member of your family. I'm Dr. Sugar. Congratulations on your newborn. If you have postpartum depression, it is very important to work with your healthcare team to develop a plan that works for you and your lifestyle. Take care of you and take care of that new bundle of joy. Thanks for watching, and if you haven't already done so, make sure to watch all the videos in our series on postpartum depression. And when you have a medical question, be sure to check the video content library for many more medical topics. I'll join you soon for your next dose of medical inspiration.
Sugar.